Who here thinks that pulse diagnosis is really hard? Definitely me. Pulse diagnosis is the most subjective of all of the diagnostic methods that we have in acupuncture. That's true for TCM, and that's true for traditional Japanese medicine. It's so subjective because the person who's feeling it is going to put different amount of pressure, different location with their fingers, and that's going to equate to different things depending on how they use that information. So it becomes really hard to really dial in your pulse diagnosis and to, of course, feel confident about that pulse diagnosis. Having confidence in your pulse diagnosis can really change the outcome of not how only you feel when you're coming into your clinic, but also the results that you get with your patient on the table. In today's video, I'm going to dial in a simplistic, easy way to take the pulse and how to match that up with the Hara. Now, I've already made a video about this, talking about the pulse diagnosis and your posture, so I'm going to reference that video a little bit in this video, but if you want, please do check out that video as well. I'm going to go ahead and link it in the description box below. My name is Maya Suzuki, and I started Shinkyu University several years ago because I saw so many practitioners struggling to truly bridge their TCM practice into the traditional Japanese medicine practice of their dreams. In Shinkyu University, we talk not only about pulse diagnosis, but Hara diagnosis, and how to connect that theoretically to the whole body, and of course, how to connect that to the technique that you'll need to use to actually get the results in your acupuncture and moxibustion practice. If this all sounds really interesting to you, you're going to want to set up a chat with me. There's a link for that chat in the description box below. That chat consists of us talking about your practice and the barriers that you need to overcome to really achieve your dream traditional Japanese medicine practice in your clinic. And of course, to get the higher results in your clinic so your patients can feel better. Again, the link for that is in the description box below. All right, so let's get into it. Now, in pulse diagnosis, one of the most common mistakes that I see practitioners doing is that they're not putting their fingers in the correct place in order to take the pulse. So let's just cover that really quick because, like I said, I did cover this in a different video, but it is really important.
Now, what I tell all of my students is the very first thing that you're going to want to find is the styloid process. Really easy, that's the little bumpy part on the bone. You're going to then want to take your middle finger and wrap it around so that the line of your third metacarpal joint is going to line up and be at the very top of that styloid process, and then wrap it around so it gets next to the bone. Then you're going to want to line up your first, second, and third fingers so that they fall in line. Now, if this is my wrist, and so I'm going to be able to have my fingers right next to each other. If someone was smaller than me, I'd have to put my fingers closer together or maybe take the pulse one at a time. And if someone's taller than me, I'm going to have to spread my fingers out because the placement of what we're looking for on the artery is going to be different because that person is bigger than me. Next thing to consider is always the pressure. Now, if you want to look at my fingers, look that the sun and the guan pressure is the same. The chur position is going to be a bit deeper, always a little bit deeper, unless the person is, I don't know, under 18. Everyone else, if you're 18 and above, you are slowly sliding towards the grave, so we need to have a little bit more pressure on the chur. Now, we're going to want to make sure that we're finding the top of the radial artery, the bottom, and then the middle of the radial artery. Again, the top, bottom, and then the middle of the radial artery. That is your true pulse. If you're not taking this position every single time and at that same pressure, you're going to get a different pulse reading every single time you take the pulse.
Now that we've covered the basic position of where your fingers should be on the pulse and the pressure that you should use, you also need to think about, of course, what you should expect to see on the pulse. Now, normally we want to see a nice, gentle amount of pressure from the sun through the guan, meaning that the sun and the guan are about in the middle position of the artery, and then the chur is usually a little bit lower, as again, most of us are slowly sliding towards the grave. However, I would say for most people, we do see a little bit more elevated spleen and stomach, or want to see a little bit more elevated spleen and stomach pulse. Then the sun is going to be nice and gentle in the middle position. It's not going to be floating at the top of the artery or very deep within the artery. Again, the guan is going to be a little bit higher than the sun, and then the chur is going to be a little lower. Now, if we see something outside of that pattern, we can now start to see abnormalities in the pulse. Now, one of the major differences between TCM and traditional Japanese medicine, of course, when looking at the pulse and everything in general, is, of course, what the basis of disease is, and therefore what we should be searching for within the pulse, within the Hara diagnosis, palpation, theory, all of it. And that is, at the root of TCM is excess, usually, and at the root of traditional Japanese medicine styles, at the root of illness is almost always deficiency. Now, I'm sure there's a style out there in traditional Japanese medicine that will prove me wrong. The rule is always the rule until the rule is no longer useful. However, most of the time, at the root of almost all styles in traditional Japanese medicine is deficiency. This is going to be true of Iyashinomichi style. This is going to be true of Japanese Minoran therapy. This is true of Toyo-Hari. This is true of Shakuju. Always at the root of illness is that the body has become deficient, and that has allowed the body to get ill. So what that means when looking at the pulse is that we have to look for the most deficient pulse in order to guide what we are doing. And in juxtaposition to that, it is nice, especially if you are TCM trained, to also look at the most excess pulse to understand where the imbalance then lies. Now, if you were to look at a traditional Zongfu pulse, that would make a lot of sense because we're looking at the imbalance of, for example, the spleen versus the stomach or versus the liver or whatever. Saying that though, in the style of pulse that I want to treat you, we're going to look at the pulse a little bit more simplistically. It's going to be an older version of taking the pulse, and we're going to split the pulse really simply into areas of the body. So the sun on my right hand is going to be the right upper part of my body, the upper jiao right side. The sun on the left side of my body is going to be the upper jiao left side of my body, and so on and so forth. So if my right guan was really deficient, then that means I would have deficiency on the right middle jiao of my body. So it's a very simplistic and easy way to take the pulse. I'm going to show you how that looks when we actually do it in treatment, comparing the pulse to the tongue to the body. So before I've made a video about pulse, and I'm going to link that up here, but really what I want to talk today about is the link between the pulse and the Hara and how that can really make a difference for your practice. So the few things that you really want to be careful of is how you take the pulse. Now there's a few different methods that I've seen my teachers take. One is where you splay the hands up and out. So if you can see, her thumbs are facing up towards the ceiling. Another way I see a lot of people take the pulse is with them laying on the belly and really relaxed. One of the ways that I really would like to caution you against taking a pulse is taking the pulse here and then wrapping your arm around your back. I've seen this quite frequently in TCM practitioners. The reason why I recommend against this is because this is going to cut off your personal circulation and therefore probably some of your ability to feel the pulse. So if anything, if you're going to do one-handed, just let this hand relax by your side and have a nice open stance. Now my bed is at a really nice height for me, but if the bed is too tall for you or too short for you, go ahead and match up your hip bone to your patient's hip bone and just sit right on the bed, and then you're going to be more lined up to take. So now let's talk about the pulse in relation to the upper, middle, and lower jiao. Now this is a slightly older version of taking the pulse as compared to taking it with the organs and the viscera, but I'm going to kind of explain it to you first by doing it here on Deirdre, both taking her pulse and then explaining what I should or maybe feel on her belly and her chest, and then I'll also give you a digital visual. So I'm always going to make sure that I take the exact middle of the artery. A lot of people, when they take the pulse, they're either feeling the very top of the artery, the very bottom of the artery, or their fingers are in different places for each part of that artery. So you really want to make sure your fingers are lined up in the correct position and that you're taking the center of the pulse. Now for her pulse, what I could possibly expect to see is maybe a little bit of tension behind the right part of her neck, a little bit of tension along the middle back, and possibly some issues with the lower belly, possibly. And the reason why I'm doing this is because I'm really matching up the position of the pulse to the position of the upper, middle, and lower jiao. So the upper sun of the pulse on the right is going to be the upper jiao of the right side of the body, and so on and so forth. So if I feel something that's a little bit wrong in the pulse on the right sun, I'm going to say, well, maybe there's something going on the right side of the body. I'm going to then go ahead and compare that to her tongue, and then compare that to her Hara. Okay, and can I see the bottom? Thank you so much. All right, and then I'm going to check the chest and belly. Now, because this isn't a full informational video, again, if you're interested in that, please do join Shinkyu. That's something that we go through quite a bit in the platform. I'm going to run through this and just kind of tell you what's hopping out at me. I'm not going to explain that all in detail though. So we're going to go through the Hara diagnosis, and again, I'm going to try to see if what I found on the pulse is going to be presented here on the chest and the belly. Now, Hara is just the term really for the belly or the abdominal cavity, depending on who's speaking in Japanese. So we're going to start here. This is an Yashinomichi Hara diagnosis. Definitely a little bit of tension here and a little bit of tension here. And so meaning that I'm going to more than likely find tension here on the back of the neck. There's also a little bit of jaki here in the chest. And then just in general, for a normal breath, you'll notice that her lung doesn't expand really well. There's not a lot of breath, or space, I should say, for her to get that breath in. Now again, I'm going really quickly through this Hara diagnosis and not really explaining all the positions and everything I'm looking for. But if you are interested in that, you can definitely set up an interview, see if you want to chat about learning more in Shinkyu. So really the only thing I'm really interested in the belly, to lift this up, is really this area, which is about Ren 12 and up. It's just a little bit stuffy, and in particular right here. And then I would just like to see a little bit more strength in the lower abdomen, just a little bit more fullness. But to be quite honest, I'm really happy with her abdomen, and I'm also happy with the shape of her belly button, which sounds super weird, but ideally a really healthy abdomen is going to have a vertically taut belly button rather than a horizontal one, meaning like that. So we want to see, and you can see that Deirdre's belly has a little bit of a vertical positioning, and so that means that her belly is actually doing really well. Pretty happy about that. Now, what I've just showed you is by all means not the be-all end-all of taking the pulse or looking at the Hara. I've skipped a lot of steps. I do have a very in-depth Hara video that I have on YouTube that you can definitely check out. I'll link that below. And then of course I cover this all the time in Shinkyu University. So if you're looking to learn more about this, please let's chat. However, for the sake of this video and the sake of your clinic and your practice really getting to that next level, I would love for you to go back to your practice and really just take away this one homework assignment. Now, before I get into the homework, real quick, I have a question for you. How much confidence do you have in your pulse diagnosis? Let me know in the comments below. Okay, so let's get into the homework. The pulse is quite difficult, and it's very difficult to become confident in it. So what I want your homework to be is every time that you take the pulse going forward with your clients in clinic, I want you to make sure that you're placing your fingers in the correct location. Again, I covered that at the beginning of this video, and that you're putting the right amount of pressure on that pulse every single time, meaning that we're going to take out any of the things that you might have done differently in the past to give you different results right now and in the future. So that way you know exactly the information you're getting, and then going forward, all we have to do is just try to understand that information. And that's a whole different video. For today, really go back and I want you to practice the location, practice that pressure. Now, if you have time, I would also love to see if you could take the pulse and put it in relation to the upper, middle, and lower jiao on the right and left, and see if it matches up to your patient's symptomology. All right, that is all for today. Thank you so much for learning with me. Your time, energy, and effort really do mean a lot, and it's a huge compliment that you spent it with me today. If you'd like to learn more about traditional Japanese medicine, don't forget to like, subscribe, and hit that bell to be notified of future videos all about TJM medicine. And of course, if you're looking to continue on this study, do reach out to me and let's chat.
Oh, so cool. He's like trying to make heavy breathing.
Hey, you can just go close the door because he's something. Yeah, I don't mind at all. It's okay.
I don't use my mom voice.
Like you're like, oh, it's stopped. Oh, stop. Okay. Do you want? Should I just say something about the door? No. Oh, that's so. Did you knock on the door?
So
Was that not creepy?
it was so weird.
I was like, I think your is haunted.
Just put the water jug in front of it if you wouldn't mind.
Yeah. Oh, so go lay down.
The latch isn't really strong,
Yeah,
and so they can just like push it open.
The knock was.
that was weird. That was really weird.
For your next video, I highly suggest learning more about Hara diagnosis. Please check out that video right here.